Hi everyone, Amber Canoy here with Everyday Kentucky. We are visiting Solutions Functional Medicine with Mandi Snell. And women, listen up, we're talking about mood swings. Okay, so is this predictable? I mean, what do we need to know? Because it seems a lot of women and a lot of men would say that women suffer from mood swings.
Yes, that's true. That's very true. So mood swings are just simply not acknowledged well enough as a very viable, significant symptom of perimenopause and menopause. These symptoms are so debilitating that they disrupt homes and they disrupt relationships and well-being and so easily. These emotional fluctuations are not just minor irritations. They are disruptive and they hurt relationships very much. These emotional changes are due to fluctuating hormone levels, particularly estrogen and progesterone. Unfortunately, many women feel like they've been dismissed as they start to talk to their providers about them. There are a lot of women who feel unusually vulnerable, sometimes around mid-40s. They go to their doctor and say, something's just wrong with me. My kids are pushing my buttons, and that's just not like me.
Or you're speaking to a girl.
And or they feel like they bit somebody's head off at work, and they don't even know where this comes from. And in vulnerable moments, they share these often in traditional medicine and may be left with a psychological diagnosis instead of a hormone-related one, which is just very unfortunate. These fluctuations are very predictable. It's not a matter of if this happens to a woman, it's just when it happens to a woman. And to have that validation, to hear someone recognize that, oh, guess what, you're not crazy. You're right on schedule. You are progesterone deficient because you simply are not ovulating consistently, and there's some things that can be done about it. It's validating and it's life-giving to women.
Can I ask you a question? Let's define, because we assume that maybe everybody knows what perimenopause is.
Sure.
Let's define it, because there's a lot of talk about that out there right now in the media. That can start even in your late 30s, by what I understand.
That's exactly right. The North American Menopause Society deems the most common age for menopause is 51 and a half. But perimenopause can start as early as 10 years before that, and yes, it can happen in the late 30s. It absolutely can, and that needs to be recognized. Perimenopause is on the map. Women are no longer willing to be dismissed and having these symptoms recognized, and there's so many symptoms, of course, besides mood swings, joint pain, insomnia, hot flashes, night sweats, but these things can start as early as the late 30s.
And you say there's things that we can do to help this. So what are a few examples?
Well, so many things are available. First of all, acknowledging validation and not treating it like necessarily a psychological issue is one of the first things that's important. Also, there are hormonal and non-hormonal options available, and women deserve this conversation.
And I would think also just what you're putting in your body overall on a daily basis.
Absolutely.
Plays into it.
Lifestyle, diet, exercise, moving your body, sleep regulation, all these things are a part of it. Hormone replacement therapy is a viable conversation that every woman needs to have. Women need to know exactly what their personal risk is in numbers, because we all know that we have grown up all of our adult lives hearing for the last 2 decades that hormone replacement therapy causes breast cancer, clots, and risk and disease. But that data is being questioned severely in the last 6 years, and so women need to find an individual provider who knows how to find them the science and the risk that belongs to them.
All right, if you have any questions, give them a call. Go online, because I know you've got a lot more questions.